हेलो। हाँ, स्टूडियो में आप नहीं हो क्या? हाँ, पर आया ही नहीं हो, लाइव ही नहीं हो। हाँ। नहीं, सही चल रहा है, मतलब फोन वोन पे तो। ठीक। Good evening, everyone. Just check with the audio and video, all is fine, and we are good to go. So, we are back with the MCQ session on orthodontics. Myself, Dr. Rajul Agarwal, I'm the orthodontic faculty at DAMS. So today we are back for our daily MCQ session. Today being the ortho subject of orthodontics. Okay, so we have got good to go ahead message from the technical team. Okay, so move ahead. So once again, good evening everyone, and those who are listening, thanks for joining. I hope, as I say every time, we have a maximum participation. Even if you're wrong in your answer, there is no issues. We are here to correct and help you out, and there is no, it's not an exam. Okay, in your exam, you yourself will get to know where you stand. Okay, so this is these sessions are there for you to help you out, revise the session, revise the subject, and get to know where you stand. It's a kind of a self-assessment thing. Okay, so don't be hesitant in answering. Okay, so without wasting further time, I'll give the first question on the screen and wait for a minute or two before moving ahead. So the first question: a major criteria to differentiate between true class 3 and pseudo class 3 malocclusion is degree of anterior crossbite, presence of bilateral crossbite, occlusion relationship between maxillary and mandibular first molars, and existence of a forward shift of mandible during closure. A very easy question to begin with. True and pseudo class 3. So we have people coming up late. Good evening, Komal. Komal says option D. Anyone else? True and pseudo class 3. Pseudo means false. Okay, so I'll tell you the answer. The answer is indeed D, that is existence of a forward shift of mandible during closure. Degree or amount of crossbite do not indicate the difference between true and pseudo class 3. True class 3 and pseudo class 3 difference is that technically it's not a class 3, but due to forward shift of mandible. Why this forward shift occurs? Because of any because of any occlusion interference. So the patient shifts his lower jaw in the forward direction so as to achieve maximum intercuspation. Okay, occlusion relationship between maxillary and mandibular first molar? No, it is technically class 3 in both the cases. So it cannot differentiate between true and pseudo class 3. Presence of bilateral crossbite, it may or may not be present. Okay, so one more important point for you is bite of accommodation. So in patients with posterior crossbite, the patient, likewise in class 3 and pseudo class 3, the patient shifts his lower jaw forward. So transversely in patients with bilateral crossbite in which the teeth are not coming in intercuspation, the patients have a tendency to shift the jaw laterally so as to achieve maximum intercuspation, known as bite of accommodation. So for likewise for class 3 it's pseudo class 3, Sunday bite for class 2 in sagittal plane. In transverse plane we have the term bite of accommodation. Okay, so this was an important add-on point for you. I always said study MCQs with the aim that one is the correct and rest 3 incorrect. 3 more questions can be formed from the same question. Study like this and you will never go wrong, and you never need to mug it up as well. Okay, anyhow, moving towards the next question, a case-based question. A 10-year-old patient has a mandibular canine trying to erupt into a space insufficient by 2 mm. Primary second molars are large and firmly in space. First premolars are erupting. 4 is erupting, E is firm. An acceptable preventive orthodontic procedure for this case would be acceptable preventive. So what are we trying to prevent here? We are trying to prevent this space insufficient by 2 mm so that the canines erupt properly. Options: extracting the first premolar, placing a removable bite opener, extracting the mandible primary second molar, disking the mesial proximal of the mandible primary second molar. Anyone with the answer? Space is insufficient by 2 mm. Komal says extracting the mandible primary second molar. It also say C. Anyone else? Okay, so we'll discuss. The correct answer is option D, disking the mesial proximal of the mandibular primary second molars. Why? First of all, students, in a question, in an exam MCQ question, if you read the instructions carefully, I say this many times because that's what my teachers taught me, you don't have to mark the correct answer. Instructions में clearly लिखा होता है mark the most appropriate answer. Now coming to this question, history देखते हुए age है 10 years. So approximately by this time the second molars and the first deciduous molars should have been come exfoliated or should have been in the process of exfoliation, and the premolars should have been started to erupt. Okay. Now the canines are trying to erupt into a space insufficient by 2 mm. Mind it, just 2 mm. Primary second molars are large and firmly in space. Means they are firm, means their roots must be of good length. There is no radiographic evidence, nor it is mentioned in the question, nor there is any mention about the presence or absence of second premolar. Okay, first premolars are erupting, 4 is erupting. Now the question में एक clear last में लिखा है acceptable preventive orthodontic procedure. Extracting the first premolar out of equation. Okay, 2 mm space के लिए we cannot extract a 8 mm premolar, not an option. Placing a removable bite opener, it won't do anything. We don't have a problem in overbite, we have a problem in arch length space discrepancy, 2 by 2 mm. Now the option number C and D. Extracting the mandibular primary second premolar, E. Now students, if we extract E, there is no mention about evidence about the 5. Now they are firm and large in space, that means there are high chances, because 4 is erupting, 5 E का कोई भी sign नहीं है, that means इसका succedaneous 5 either it is not formed or might be delayed. High chances it is not formed because this line, they are large and firm in space, and if we extract E at this stage, what will happen? The posterior 6 will drift into this space, and we require the space mesial to 4 for the canines to erupt. E are so big in size, approximately 10 to 12, 8 to 10 mm, I don't know the exact dimension. Okay, how do you expect to gain, you extract such a big tooth without the evidence of their succedaneous teeth being there, and that too a teeth which is posterior and the problem is anterior by 2 mm. So the most appropriate solution in this case would be just disking the mesial proximal of the mandible primary second molar. 2 reasons: because the discrepancy is by 2 mm. First of all, not much discrepancy is there. Okay, so, and second, there are high chances that we might have to retain this E in place of the second molar. Okay, hence D is the most appropriate or correct answer for this question. I hope I am clear and with my explanation. Questions like this case-based scenario, each and every point carries a significance. 10-year-old, age bata di. Canines are trying to by insufficient by 2 mm. Primary second molars are large and firmly in space. Sabse biggest for this question, they are firm, and at the same time 4 is erupting. That means 5 either is absent or not formed. Okay, do not wait कि उन्होंने radiograph evidence नहीं दिया and all that, but they have clearly written this line. Okay, next question. A 9-year-old patient exhibits a lingually locked permanent maxillary left central incisor. Supporting bone is in harmony with tooth size and there are no basic discrepancies in other relationship. Most probable etiological factor for this is, now they are not asking you about the treatment, here they are asking you for the etiology of this kind of malocclusion. Premature extraction of the primary maxillary right central, prolonged retention of primary maxillary left, premature extraction of primary maxillary left with space loss in the area, pronounced fascioversion on eruption of the permanent mandibular left central incisor. Again, each and every line carries a significance for this question. Age is 9 years. One is in crossbite. Remember the eruption pattern. Question 3. Prachi says A. Rit says option D. Someone says option C. So we have A, D and C for question number 3. Anyone else? Okay. So the correct answer is the one which you all of you have not said. Option B. Sessions that these are informative, but it becomes quite frustrating for me because I am not able to get the reason out of the students why they thought as A, C and D. So being able to help out, I can only put up my point of view from here. Okay, but it's good, at least you guys are participating and attempting. That is what it is wanted, and the concept gets clear. Now the child is 9 years old. The upper incisors erupt around 6 to 7 years, 3 years for the root completion to take place. It's lingually locked. Okay, supporting bone is in harmony with tooth size and there are no basic discrepancies in other relationships. Means other teeth are all good. Other permanent or teeth whichever have erupted are in good relationship. There is no discrepancy, harmony problem in any other teeth. The most probable etiological factor for this is, now since it is mentioned here, option D gets out. Pronounced facial version on eruption of the permanent mandible left inside, since saying all other teeth are in good relationship. Leaves us with option A, B and C. Option A, premature extraction of the primary maxillary right central incisor. अगर प्रीमेच्योर एक्सट्रैक्शन हो जाता है वो भी राइट का, मीन्स A or 5-1. Okay, so what will happen? The erupting 1-1 will be delayed. Okay, so if it's delayed, so what is the issue? How it will influence 2-1? True, there can, due to the delayed eruption of 1-1, 1-2 can encroach on its space leading to its displacement. So even if it's delayed, 1-2 gets encroached. Remember the upper central incisors, the incisor liability, the upper central incisors erupt liably so as to gain enough arch length for the permanent teeth to erupt. Okay, so as to compensate for the increased mesodistal dimension. Okay, so premature extraction of right won't do anything. That's C. Premature extraction of primary maxillary left with space loss in the area. Again, if we prematurely extract left lateral with space loss, So what will happen? The upper one will be labially present, not lingually. It can go only in lingual position if the A corresponding A is retained for a long time, leading to the displacement of this in the palatal or lingual direction. Okay, hence option B. I hope I am clear. Next question. Third question, anyone has any doubt? No? Then read the next question. Again, a case-based scenario. A mother of an infant reports to your clinic with a complaint of extreme open bite with only the most posterior gums in contact in the opposite arch. The best procedure for dentist would be to refer the child to an orthodontist for treatment, wait and watch, make an overlay denture to create occlusion, start with myofunctional appliance therapy. Rit says option B for fourth question. Komal also says option B. We have a student joining late, HS, so we'll wait for him to read question 4 and answer. Good evening to you as well. So he also says option B. Okay, so yes, option B is the correct answer. I discussed it last time also. Development of occlusion carries a good number of such case-based scenario question. Okay, they'll give you extreme option like start with myofunction. The patient does not even have a teeth in his mouth, gum pads, and you prescribe an appliance like this. Yes, it's self-correcting. Okay, but sometimes the people get confused with this word. Extreme is written, sir. Extreme है तो कुछ तो करना ही पड़ेगा इस टाइम पे. What will you do? Patient has gum pads in it. Do you expect an infant to wear a appliance or something? No. So this was a very straightforward question. Students get confused. Please self correcting anomalies का एक table है. I have summarized that in development of occlusion. Go through that. Okay, and do not get confused. Okay, so these are the self-correcting anomalies at this stage. Tongue between lips, maxillary gum pads wider than overlaps the mandible, vertical gap between both jaws grows rapidly, and there is complete overjet. Next question, which of the following is not an etiology of malocclusion? Ectodermal dysplasia, lip sucking, genetic factors, supernumerary teeth. Option A. So yes, option A is the correct answer. Nip sucking is a habit, can lead to crowding in the teeth. Genetic factor, definitely. Supernumerary, definitely. Ectodermal dysplasia, there are decreased teeth, that is oligodontia, or sorry, hypodontia is there. So since teeth are also number are decreasing, how can it lead to any kind of malocclusion? Okay, so hence option A. Now, image based question. According to cats, the image shows what type of malocclusion? Class 1, class 2, H2H, class 3. Yes, you are right. Due to ectodermal dysplasia, there is absence of teeth. Now, image based question for you. Sixth B. Grades HS Komal says B. Dr. Sujoy Singh says option C. Anyone else? So yes, option B is the correct answer. So students, what is CATS? CATS is a premolar classification system. Like angle system is for molar classification. We have British incisor, we have canine class. CATS or Morton CATS give a premolar classification system. This was a part of a PYQ of INI, okay, in which the confusion was created by the image shown. Now the image shows that the cusps are in edge to edge relationship. So students said why not edge? But in premolar classification or CATS premolar, you have to look at these line which is drawn. The upper line is ahead of the lower, that means it's class 2. If they are coinciding, the upper and lower line, then class 1. If upper is behind the lower, it's class 3. Okay, so look at this line for answering, not at the cuspal relation of the teeth. This also was the confusion which was created at that time as well. The image showed edge to edge, but the lines were up showing something else. Okay, so this is a summary of CATS premolar. It was given by Morton CATS. See, if they are coinciding, then also it does not mean edge to edge. It means class 1. If upper is ahead, it's class 2. If upper is behind, it's class 3. And the distance between them, you can measure them and tell the how much class 1, class 2, class 3 is there. So this is also a quantitative classification system. Rest all classification system are qualitative. They will just tell you type 1, type 2, type, class 1, class 2, class 3. This also measures the amount of malocclusion which is there. Okay, so which of the following, next type of question is a quantitative, or all of the following are qualitative except. So CATS premolar is a quantitative classification system as well. Okay, clear? Next, an image based question for you to identify the appliance shown in the image. T-Rex, pendulum, carrier motion appliance, first class appliance. C. Komal says carrier motion. HS says C with a question mark. Be sure what you want to mark. In appliance identification questions, even if you don't know, you can go reverse. Which options you know or which images you have seen and which you have not seen might be the one which is correct. So coming to the question, okay, we look at the image. What has happened is there is some kind of a appliance which is placed on the buccal side. There is no palatal image, so since there is no image, so the appliance is not there on the, it's not A and B, it says. Okay, good. So we have narrowed down to C and D. Okay, so coming to the discussion, there is image shows there is a appliance which is placed on the buccal side. Next, what has happened from image 1 to 2? There is an opening up of gap here and no extraction of teeth. That means certain amount of distalization of upper teeth which has occurred. Okay, now distalization has occurred, buccal appliance is there. That means the examiner is asking you about a appliance which is causing distalization present on the buccal side. Coming to the option T-Rex, pendulum, carrier motion, first class, all of these options are of distalizing appliance. Okay, so we got confused. Option this won't help us. Now the appliance is on the buccal side. Option A, T-Rex appliance, it's on the palatal side, so hence it's eliminated. Pendulum also on the palatal side, eliminated. Option C and D, carrier motion appliance and first class appliance. First class appliance is present on buccal as well as palatal side, both. So hence option D is also eliminated. That leaves us with this carrier motion appliance or distalizing. Okay, so you eliminated option A and B, left it with C and D. So if you know first class appliance, it is present on both buccal and lingual side, you would have arrived at option C. And I always say in INI, not in NEET, INI exam have less number of seats. If you are able to narrow it down to 2 options, you have to attempt that question. You cannot, it will be a crime if you leave that question. In INI only, I am not saying about NEET. Okay, so coming to the question, so what is a carrier motion appliance? It's a distalizing appliance. It consists of this rod like thing present on from one teeth to other with an elastic which is applied by the patient. So what does this elastic do? Class 2 pattern elastic, you remember from your class. Okay, resolve the vector into 2 components like this and like this, you get a distalizing action. Sure, can you show the picture of first class appliance? I don't have it here. Okay, I should have placed it. Wait, I'll show it to you. This is the most best image. See, both buccal, no, I cannot draw it. Both palatal and buccal surface has the appliance. So it provides a more rigidity in movement, distalizing action for the teeth. Okay, so this is the first class. I have shown it in class. It's there on the app. Anyhow, we are not taking lectures for just our students. Those who are not also can see. So this is the image of first class. This image is there in my lecture. Anyhow, so it has both buccal and palatal appliance. Okay, it provides a more rigid action in distalizing. Okay, so we'll go back to our questions. Okay, so next question, choose the appropriate statement. Now the question is not asking about a true or false. Choose the appropriate statement. All malocclusions will have one specific cause, which on elimination will correct the malocclusion. Malocclusions are idiopathic in nature. Malocclusions are iatrogenic in nature. Most other malocclusions have more than one etiological factor. Choose the most appropriate statement. HS says option D. It also says option D. So yes, option D is the correct answer. Very easy. Will have one specific cause? No. All malocclusions do not have one specific. It says all. All is not. Most you can say are one specific cause. So if it had been most, then it would have been correct. Malocclusions are idiopathic in nature. No. It's a very generalized statement. Cannot be correct. Are iatrogenic? Again no. No. This is the most of the malocclusions have more than one etiological factors. Okay, if here in all malocclusions have more than, then also it would have been incorrect here. Okay. Next, choose the wrong statement. Retained deciduous incisors can cause its permanent successor to erupt lingually. In the mandible, if the retained deciduous incisor is extracted, the tongue pressure often brings the permanent incisor to its correct position if sufficient space is available. If the upper incisors are fully erupted into a lingual occlusion with a deep vertical overbite, a wooden tongue depressor can be used to correct that. The patient should bite on the wooden blade sloping downward at 60 degrees to the occlusal plane. You have to select the wrong or false, incorrect, anything. Option A was the one which I explained to you in I think third question. Anyone for the ninth? Make a guess. Even if you're wrong, they are asking about the wrong statement only. Might be correct. Option A I eliminated by my side only when we discuss the third question. So that's the correct statement. So we have option B, option D, option C, option D. Option D. So the incorrect statement or the correct option here is option C. A, I eliminated it. Option B, in the mandible, if the retained decidual incisor is extracted, the tongue pressure often brings the permanent incisor to its correct position if insufficient space is available. If sufficient space. So that means to say that retained incisor hai. So what will happen? The permanent incisor will erupt lingually in mandible, because the permanent teeth erupt lingual, permanent incisor erupt lingual to the deciduous incisors in lower and labial in upper. Okay, now if you extracted the tongue pressure, in some cases, often, it says often, not always, bring the erupting permanent teeth to its correct position if sufficient space. That's a correct statement. The tongue can do that. Option C, if the upper incisors are fully erupted into a lingual occlusion with a deep vertical overbite. If the upper incisor, now there is deep vertical overbite, a wooden tongue depressor can be used to know. Now the vertical overbite is deep, the crossbite may hai, overbite is also deep. Wooden tongue depressor cannot correct it. Wooden tongue depressor means ice cream wala stick wala therapy, ice cream stick therapy, which we give to patients to correct it. And the patient should bite on the wooden blade sloping downward at 60°. That's a correct thing. Okay, so if the patient should bite at 60°, it's not mentioning about which kind of malocclusion it is, overbite and over. So that's a correct statement. This is an incorrect statement. Why? Because of the deep vertical overbite which is written. So read each and every option and whole line correctly. Deep vertical overbite cannot be corrected by this simple thing. Okay, that's why it is recommended to you correct such kind of develop. The crossbite should be developing in nature, because once the teeth are erupted, once the incisors are fully erupted, you cannot correct it at this stage. Okay, so often the age, if it's mentioned 9, 7, 8, 9 years, okay, erupting teeth, these kinds of incisors are appropriate for such therapies. Okay, post normal occlusion is easy question. Class 1 with anterior crowding, class 2, class 3 or bimaxillary protrusion. Class 2, HS says option B. So yes, it's the post-normal occlusion is class 2 malocclusion. Class 3 is also known as pre-normal occlusion. So this is the other name for angles classification. Class 2, class 3. Class 3 is pre-normal, class 2 is post-normal. Which of the following statement is false? A system of microscopic canals in the bone is referred to as Haversian canals. A submerged molar is frequently ankylosed. The term torsiversion indicates that a tooth has erupted beyond the line of occlusion. An enlarged frenum may cause separation of maxillary center incisors. Teach each and every statement, each and every word, and eliminate them, then arrive at the correct. Now they are asking about the incorrect statement. The Sujoy Singh says option A, HS says option C. Reed says option C. Prachi also says option C. So yes, option C is the incorrect statement, hence the correct option. Enlarged frenum may cause separation of maxillary center. That is correct. May cause, not always cause. So hence it's the correct statement. Submerged molar is frequently ankylosed. That is also correct. Is frequently, not always. The system of microscopic canals in the toe bone is referred to as Haversian canals. That is also a correct statement. Okay, so a term torsiversion indicates that tooth has erupted beyond the no. It is an indication of rotation. So what is the term for supra eruption of the teeth? Then, if anyone can tell. Tooth has erupted beyond the line of occlusion, means supra erupted teeth or extruded teeth. What is a term for that? This is according to which classification? Lister classification system. So what is the term for that? Yes, so someone answered it. It's supravirgin. Okay, so just go through that torsivirgin, transposition of teeth, and all. There are three terms which cause slight confusion: mesiovirgin, lingo, labio, all you know. Okay, yes. So yes, all others are also in it's common. Yes, you're right. Supravirgin. Okay, so that brings an end to the session, MCQ session for today. I hope it was informative for you and you learned some few new points. Okay, and you will be able to answer the questions much more appropriately and correctly from now onwards. Anyone and any doubts, you can very well reach to me. Okay, I've repeatedly said I don't ask people whether you are from our institute or not. Okay, anytime just message me on WhatsApp, Instagram, Facebook. Number of systems are there for us you to reach. Those available, okay, those who are there can download our DAMS Alpha app. There are not many things available. I've also provided here the complete images in a separate PDF format. Okay, it's available in the notes section. You can go through them. All instrument, all appliances images are there in a summary. Include questions from cephalometry and aligners, please. Okay, we are progressing grids definitely to other topics as well. Okay, I included appliances image from this session as well. We include cephalometry and aligners as well. Okay, I think on Tuesday. Okay, because class aligners pe we took our class. Okay, so don't worry, we'll cover that as well before your exam. Just stay tuned. So what's your WhatsApp number, please? You asked me on my Facebook ID. My name is Dr. Rajul Agarwal. I'll tell you there. Okay, no worries, I'll definitely tell you. Just message me on WhatsApp on this. I'll tell you, or otherwise I'll write it here only. What's the point in wasting? This is my number. Message me for any doubts. I'll be happy to answer it. Okay, so I'll close the session. Happy studying, keep on studying. Anything related to ortho, any doubts? And take 2 hours of session, we really enjoy. That's not in my hand. It's that is you have we get 1 hour sessions only. So that is not in my hand. Okay, the allocated time for us is 1 hour, because the satellite channel is, the links are there, the timings are there for each and every other subjects, MD, MS, FMG, other courses as well. Okay, so anytime. Torsivirgin again, sir. So torsivirgin is a Lister classification system. Okay, it is for the teeth which term given for rotated teeth. Okay, tors. Okay, and the question is in tooth that has erupted beyond the line of occlusion means it's a supravirgin. Term for that is supravirgin. Okay, so that's it. I hope it's clear. I'll end the session. Any doubts, can ask. You have my number now, can ask anytime. Message me and I'll be happy to answer. Okay, thank you for